Hi everybody, this is Dr. Ihab Abdurrahman, Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. We are still doing our course on medication safety course, Introduction to Medication Without Harm. This session is about wrong route errors. Learning outcomes explain the reasons why wrong route errors can occur, understand ways in which you can help to prevent wrong route error from occurring in your workplace, identify available policies, procedure, and guidelines which contribute to safe use of medicines. Wrong route errors can cause significant harm, including death. Analysis of death related to medication errors found that almost 10% of death had occurred because medication were given by wrong route. Medication can be used by different routes, including intravenous, intramuscular, or subcutaneous, or sometimes even enteral through NG tube. Sometimes are given topically or as drop in the eye or ear, and also they can be given intrathecally. Consequences of wrong route error. The route of administration determines the speed with which the drug reaches the general circulation and the overall concentration of the drug in the blood. Oral medication need higher concentration than IV because they go through the first pass effect and metabolism in the liver. If a dose of medication is given by wrong route, the concentration in the blood may be higher or lower than intended, resulting in higher or lower dosing. A 3-year-old boy was admitted to the emergency room. He was on digoxin as a regular medication, 3 ml per day. And the doctor wrote here digoxin 3 ml stat. He didn't specify the route, the dose, or time. The nurse administered the drug IV. She gave 3 ml of digoxin IV solution. And when we look at the concentration, the digoxin syrup, the concentration is 50 microgram per mil. So 3 mil will be 150 microgram. And the nurse gave the solution of 250 microgram per mil. So she gave 750. So she gave almost 5 times. She gave a dose 5 times the supposed dose. This error is avoidable if the dose was written clearly, 150 microgram between bracket 3 mil or 50 milligram per microgram per mil, the route, IV or oral, the indication, and also communication between the doctor and the nurse, and anyone of the provider, doctor, nurse, or pharmacist is not sure should check a reference for clarification. This patient was given rocuronium through an arterial line instead of an IV line inserted in her wrist. The patient's right arm immediately became mottled. There is redness and it spread up to the elbow. A handwritten label made identify the arterial line was not easily visible on the bedside, and this is why the patient ended up having the medication intra-arterially. Another source of error when the medication is given through the wrong line. We can confuse peripheral line with central venous line, with arterial line, with epidural catheter, or even with a feeding tube. So this line should be well and adequately labeled. These are sample or example of way to identify the line. Use different color coded labeling for intravenous, for intraarterial, for epidural, for intrathecal. This can help to differentiate the different routes. An order for liquid potassium chloride was drawn up in a syringe to be given to a patient via enteral feeding tube. At the same time, an IV antibiotic was also drawn up in a syringe and taken to the patient side on the same kidney dish. The second nurse was called away. The nurse attending the patient proceeded to give both the oral potassium and the antibiotics through the IV line instead of the feeding tube. The patient required resuscitation. It's important that whenever we draw a medication, we put a label. For intravenous, we use a specific label, and for enteral, we use a different labeling. Another way to avoid this error is that when we are using a liquid form, it's better to use graduated cup, or when we are using a syringe, you use a specific syringe made for enteral medication. This syringe has a label that it is for oral use only. In addition, it doesn't fit on the fitting of the IV line, and this is a forcing mechanism that can prevent error from happening. A prescription for vitamin E 500 international unit was written without a route, and the international unit, the IU, look like IV intravenous. Without clarifying the order, the nurse drew up the capsule content in a syringe and gave it intravenously. Oral medication are not suitable for intravenous use. They are not isotonic, so they can cause severe irritation to the vein. They might have large undissolved particle of drug which can cause emboli, and they are not sterile and can lead to sepsis. Oral medication are not suitable for IV because usually they are intended to enter the blood slowly, and also they have different bioavailability because they go through the liver and they can have first pass effect, and fraction of the drug can go to the circulation. When you give the oral medication IV, you can give a large dose, and this can lead to severe consequences. To avoid wrong route error, we need to write clearly. We have to have clear order, including the medication, the dose, the route, the concentration, appropriate labeling of the line, IV line, arterial line, intravenous line, central venous line. Also, appropriate labeling of the syringe to match the line in which we are going to give the medication. Never make assumption a drug must never be administered by alternative route other than prescribed one. Always communicate with different provider and check a reference to clarify the order. Thank you.